to What You Need to Know with Carla Pileggi-Caviola. Today on our show, we will be talking about chiropractic treatment with our special guest, Dr. Joseph Rossello. Dr. Joseph Rossello is a chiropractic physician now for 32 years, and he is the developer of the Rossello method. Dr. Joe, as your patients like to call you, thank you so much for joining us today.
You're welcome. Thank you for having me.
Absolutely. It's an honor to have you on. So we're going to jump right in. So tell me a little bit about your story, your personal story, and then your educational story, kind of how you got into this line of chiropractic work.
Well, it started when I was a kid. I was hit by a car when I was on a bicycle. And after 6 months of casting and traction and all kinds of medical treatments, I still had a hip pain that I went to my dad's chiropractor for. And in one treatment, the hip pain went away. So that planted the seed. And when I went to Fordham University for pre-med, I had chiropractic medicine in mind, and that's what I pursued.
Wow. So you really felt the benefits of chiropractic treatment in one session, and then that really kind of
Yeah,
spurred your
yeah. I
decision
mean,
when you went to med school.
I was a kid, so I was impressed. Yeah.
What's that? Yeah.
I'm
Okay.
sorry.
So what would you No, that's okay. What would you say? I know a lot of our audience here, we're talking a lot about anything related to pregnancy, postpartum. What do you think the common challenges are for that population, pregnant and postpartum moms that might experience that you've witnessed in your line of work?
It's mostly stress related, especially if they're first time moms. And I've seen a lot of them have trouble breastfeeding because of stress. And I've noticed that getting chiropractic treatment to reduce their stress allows them to breastfeed more easily. Um, and of course, the pelvic changes that go on during the pregnancy that have to revert back to how they were before they were pregnant takes time, and the treatments help getting realigned or getting used to being back to normal.
Hmm. Yeah. And what does that look like when you say the treatments? I mean, tell us a little bit about the Rossello method, the treatments that you use, chiropractic treatment, and also with this population.
Yeah, I call it the Rossello method because most chiropractors do different things because it's done by hand, or should be done by hand, and everybody's hands are different. Everybody has different gifts and talents, and so I developed a technique that takes 7 minutes to treat the whole body, and it includes extremities and cranials and muscle testing and biofeedback, so the body tells me what they need. And it's gentle. I tell the patients everything I do before I do it, and even with light treatment, we get very good results.
Wow. So that's really great that it sounds like it's a head to toe, right, type of a treatment, your whole
Yeah.
body. How does I mean when a woman is obviously, prior to conception, then pregnant, everything changes physiologically, there's a lot of changes, and then after postpartum, like you said, again, now you're kind of um recovering from the pregnancy. How have you
Mhm.
found that the chiropractic treatment, and specifically your Rossello method, has helped to facilitate all those changes?
Also, for postpartum patients, they get back to the regular routine faster. They're sleeping better. I also include some specific exercises for their daily routine, and I also go over some of their dietary changes that they should make sure they're hydrating enough. So really look at the whole picture and basically get them back to their strongest point, their most balanced point, as soon as possible.
Excellent. How many sessions would you say? I mean, I know it's probably hard to say because every patient is different, but how many sessions would one normally have, whether it be, certainly pregnancy and then the postpartum period?
Usually I give it 3 treatments before I decide whether it's helping or not, and whether we should seek other medical professionals to co-manage the patient, at the same time, whether it be a physical therapist or nutritionist or orthopedist. Um, so yeah, I usually give it 3 times, and you should notice a significant change in just 3 visits.
That's pretty quick. Yeah. And would you
Mm-hmm.
say a lot
Yes.
of your patients also need that other kind of like treatment as well? Or do you find that it mostly does resolve within those three treatments just within chiropractic? I guess it's hard to
Usually,
say again.
yeah, usually it's enough to have my treatment, and maybe 5% or less need other treatment. It has a lot to do with, again, how much stress they have, how well they're doing with the change from an added person to take care of. It's not easy all the time,
Fair.
especially when it's the first time, right?
Yeah. Everything changes when you have a baby, right? So, yeah,
Oh yeah, for
there's,
the rest of your life.
yeah,
Yeah.
absolutely. And those first weeks and months can be very challenging in many ways. And, everybody's
Mm-hmm.
on a learning curve, right?
Oh yeah.
The parents,
Oh
the
yeah.
newborn slash infant, everybody's just kind of learning how
Mm-hmm.
to, sometimes it's minute by minute, day by day, for sure.
Sure.
Yeah. So that's really great to hear that. In fact, it's not like you have it's not like you have like a long term treatment, like even within 3 sessions of your Rosello method chiropractic treatment, your patients can feel significantly better, at least 95 or more percent.
Mm-hmm.
And then some of those might need collateral sorts of interventions as well, in addition to that. So that's pretty amazing. That's a great percentage for sure.
Mm-hmm.
What would you yourself for people that, again, maybe they don't know much about chiropractic treatment or, might be leery about it or maybe have any misinformation. I mean, what would you say for someone that doesn't know much about it and then they would, you know, want to know more about it, but also understand what the benefits are?
Mm-hmm. I would definitely get a recommendation from a family member or a friend, and stay away from the internet, because there are crazy things on the internet that'll scare anybody away from
Okay.
getting treatment care that they need. Mm-hmm.
Okay. So people shouldn't be Googling things, Dr. Google this and that. I mean, for sure that can, I know, cause, my field, which is mental health, can cause a lot of anxiety for people when they're Googling all these things and coming up with all these diagnoses. But so instead of looking online and then, potentially getting anxious about chiropractic treatment, how can you, how can you, highlight the benefits to them for any viewers that we might have today?
The benefits of chiropractic care,
Yes.
or the benefits of, okay.
Yeah,
So
the
most
the
important thing
benefits of
is, go ahead.
chiropractic care. Yeah, and seeking a specialist like yourself.
Yeah, I mean, the most important thing is to uh, reduce the amount of stress that misalignments in your joints might be causing to your nervous system. And because your nervous system is the controlling system, if you take the stress off of it and it's allowed to work the way it should, your body will be functioning at its best. So it's really that simple. And it shouldn't take that many treatments to make a noticeable change. And with postpartum
Hmm.
women, most of them are young, of course, and their condition was temporary. It was not a chronic thing, right? Being pregnant.
Right,
So it's
that's
something
right.
that
Yeah.
they, quote unquote, get over, or they're through in 40 weeks, usually around there. And at that point, because they're usually in good shape, they're young, and they have a motivation to be healthy, taking care of a baby. For all these reasons, they seem to get well really fast, and then get checked once in a while for the added stress that might cause the misalignments to recur, and that could be once every month or even 3 months.
And what would that be for, like maintenance or anything specific?
I mean, you can call it maintenance. I call it a checkup or a tune-up.
Oh, just
You
a
know,
checkup,
it's
tune up, follow up.
it's something that yeah, it's something that I include in general health practices like exercise, sleeping properly, eating properly, uh, making sure you don't have any in your body that might be interfering with your nervous system, proper mental attitude,
Mm-hmm.
uh, spiritual attention, all those things that affect our lives. Getting your body physically aligned so that the nervous system is working as well as it could should be included in part of that, of your healthcare maintenance or healthcare
Mm-hmm.
system, if you want to call it that.
That's really interesting. Yeah. And do you find that there's a shift in not just the physical, but if you're talking about the nervous system, do you find also shift in like emotional well-being, things like that with your patients, just out of curiosity?
Yeah, it's great because once your nervous system, which controls everything pretty much, is more balanced and less stressed, then your emotions are definitely affected. Your hormones are definitely better. Your glands are working better. All your organs and systems are working better. So your emotions are definitely more under control.
Yeah. So this is really a kind of treatment that really alleviates the nervous system. From what you're saying, taking the stress off the nervous system can really have multifunctional benefits, right? I don't know if that's the right word, but
Right. Oh yeah.
certainly a
Mhm.
vast a
Yeah, that's good. No,
vast
that's good.
variety of benefits physically, maybe, emotionally alleviating, again, just taking that extra stress off your nervous system, moving your nervous system into more of a healthy place is really, really
Right.
essential for your whole
Yeah.
body to function in
Right.
alignment.
Yeah.
Yeah.
Well said. Yep. That's very
That's
good.
really,
Hmm.
yeah. Well, I'm learning from you, so I appreciate this, and I know our viewers are learning a lot as well. So, what do you think, Dr. Joe? What do you think that the barriers can be that might hinder people from seeking chiropractic treatment, or women that are pregnant postpartum? What do you think those barriers might be?
Well, it's a lot to do with expectation. You know, very often a patient will have a certain expectation. If that's not met, or that they'll be disappointed. So I usually recommend that a potential patient would ask their friend or family member that has gone to the chiropractor what to expect, what they usually do, because we all do different things in different ways. And uh, I think that's a barrier. And then there's fear because people look at the internet and they see some crazy stuff on there that scares anybody that really isn't
Sure.
happening. Because,
Okay.
as far as putting belts around people's necks and pulling on them, if
Oh,
chiropractors did that, our malpractice insurance would be crazy high, and it's very low. The risks are what malpractice insurance is all about, and our malpractice insurance is so low compared to other practitioners that we don't hurt people. The stuff they show on the internet with belts around people's necks, that could hurt someone, and that's not what most of us do.
yeah. Wow. That does sound scary and quite bizarre and crazy, and right? Like, I know I myself have been to the chiropractor and I have never seen anything outrageous like that. In fact, I've only experienced
Mm-hmm.
the benefits of chiropractic care.
Mm-hmm.
Um,
Right.
including during my pregnancies and postpartum. So that I can tell you for
Hmm.
myself, I understand what you're saying, but obviously from a
Hmm.
patient perspective, right? Um, that's really crazy though. I can't believe those crazy stories. So what other
Yeah.
barriers do you find? Like, do you find that like finances can be a barrier, or like insurances, or like how does anything like that, like how does
Um,
that work for chiropractic treatment?
yeah. Again, if you get a recommendation from a family or friend, you will also talk about how they they receive payment for their services. So that won't be a surprise. I know some people accept insurance. I specialize in house calls, and insurance doesn't pay for that. And just getting the insurance in between the patient and the doctor is not good because the insurance companies very often decide on the number of treatments that they allow, and they're decided by someone who's not a medical professional. It's by an administrator, and it's not really good for anybody to have someone that is not a medical professional making recommendations on treatment. So, yeah, I just
Absolutely.
don't
Yeah, that makes sense.
like the
Yeah.
whole idea of insurance. But like your question, to answer your question is, again, if you get the expectation from a patient, friend, or family member, you'll sort of know what to expect once you get there. And
Mhm.
that's every practice is different as far as what they charge and how they receive payment.
Okay. Okay. So people can definitely do research, get referrals, right? Like, especially family and friends, they might have their own experience with a provider and really just get those referrals so they can, understand what the expectations are and payment and all of that information before they
Hmm.
come in.
Yeah,
Um,
I personally don't turn anybody away because of money. If there's some kind of money issue, then I have done a lot of charity work, and that's not my main motivation. My main motivation is to help people that are in front of me. So that's
sure.
also varies from doctor to doctor, I'm sure.
Well, that's amazing that you've done that, Dr. Joe, and sure that you've blessed a lot of people with your work and your Rossello method and helping to alleviate that nervous system. That's pretty amazing to hear. So that's great that you're able to work with people, or maybe use a sliding scale or something like that. Even should that be a barrier for someone? Yeah.
Yeah.
What do you think the most important tips are that you would want to give anyone? I know you've given a lot of tips, but any other tips that you would like to, share with somebody that might be struggling right now, maybe with pain, discomfort, maybe a pinched nerve, or, some sort of situation
Hmm.
that you know, maybe common situations you see with patients. What would be important tips for them?
Well, what's coming to mind is something that we spoke about before are the people that are scheduled for surgeries, whether it be a shoulder surgery, knee surgery, even C-sections. If you haven't tried something conservative, like by someone that is well versed in adjusting shoulders, knees, pelvises, um, then I would advise you to do so if you want the opportunity to avoid the surgery. Because I would say the most exciting cases I've had are ones that were scheduled for surgery, and I treated them once or twice, including C-section scheduled, and they went back to the surgeon and they said, well, the baby's turned around now, you don't need C-section. So there are certain
Yeah.
techniques to relax the pelvis so much that a breech baby will turn around and be delivered naturally without surgery. So that's really encouraging to me, and just want to encourage people that are scheduled for surgery, if they'd like to try something before they go in to the hospital, to try something conservative that has been successful.
Yeah. That's really, really important information. And that's definitely very interesting to know, again, for the viewers out there today that might be in a situation where they might say, you know what, I am scheduled to do this surgery, whatever it might be, knee, shoulder, C-section, etc. But you know what, there's something that they could potentially try that's less intrusive first, right? That might actually potentially change that outcome. So that
And
is
you should know
definitely
in
important.
yeah, and you should
No, go
know
ahead.
in one, two, two or three treatments, you should know if it's going to make a difference. So it's not like you're going to postpone your surgery that long. It's possible, So it's not like you want to
Absolutely.
postpone it at all. You could just try something before you schedule for surgery, because surgery is usually planned way ahead of time.
Right, right. Absolutely. Yeah. That's really amazing. And hopefully, yeah, that's really great that there are potential other outcomes that are again less intrusive, right? Interventions should
Yeah.
that
Hmm.
should
Yeah.
should that be of interest to the patient, of course. Um,
Hmm.
and I know you talked about how to find a provider by asking, friends or family, getting referral. Would you say all chiropractors treat a perinatal population, pregnant, postpartum moms, or are there certain chiropractors that, maybe have certain training to work with this population?
I would say it's a subspecialty. Someone that's experienced at it, you probably get um, results sooner. Um, there are chiropractors that specialize in personal injury. Some specialize in children. Some specialize in older adults, seniors. So yeah, I mean that's part of it. I would definitely ask what kind of experience they have with pregnant women and postpartum women. Yeah, that's a good question.
Absolutely. Yeah. We want to help people to get to the right providers, right? And so understanding
Yeah,
that
yeah.
this is
Hmm.
really also, besides being a chiropractic doctor, this is also a specialty that you have is working with the perinatal population. Um,
Yeah.
Excellent. So, if any of our viewers today would like to reach out to you, and tell us where you're located, where you're licensed, so that if they are in that state and if they'd like to reach out to you in regards to your services, whether it be home
Mm.
visits or any other services that you provide, how would they get in touch with you, Dr. Joe?
The best way to reach me is my phone number, and I usually don't answer it unless I recognize the caller. So maybe texting first would work, or calling and leave a message
Okay.
is fine. I'll return the call, or the email, or the text. Yeah, instead of an email, texting to my phone or calling my phone is probably the easiest way, fastest way.
Okay. Okay. And where are you located, Dr. Joe? Where are you licensed to see patients?
So I have a chiropractic license in New York for 40 years, in Connecticut for about 25 years, and I'm sitting for the board in Florida in May. So I'll soon have my license in Florida as well. And sometimes I cover friends' practices, so patients that prefer the office can see me there, or most people prefer house calls just because it's so convenient to have their whole family treated. And I also go to offices and treat the staff of a business in case that's what the owners prefer.
That's amazing. So yep, you are licensed in New York State, Connecticut, and soon to be Florida. So that's
Yes. Mhm.
amazing work. It sounds like most people prefer the home visits, but should they want to see you in an office, that's possible, I guess, a possibility. And also, you do special events for corporations or nonprofits, things like that. You can go in and just
Yes.
treat them on site, right?
Hmm.
On site, whether it be in a
Right.
home or whether it be in a company or work setting.
Yeah.
That's amazing. Wow. So what is your cell phone for those people that might be interested? What would they would first text you and then you could certainly speak to them over the phone. What is your cell phone today, just so we can share that with everyone?
Okay, it's 203-561-024. And they can call and leave a message or text. So once again, if that didn't come through, okay, it's 203-561-2024.
Excellent. Wow. Well, this is so amazing. I have learned a lot from you, Dr. Joseph Rossello. I know that's your full name, although your patients like to call you Dr. Joe. It has been truly amazing to have you on the show today and share your wealth of knowledge about chiropractic treatment and obviously the subspecialty of working with the perinatal population. I appreciate you sharing your expertise with myself and the viewers today and helping us to
You're
gain
welcome.
clarity regarding this amazing work you do as a chiropractor.
Thanks for having me. I appreciate it. It was fun.
Absolutely. Absolutely. Well, it's been an honor to have you. And again, to anybody viewing today, if you would like to be in touch with Dr. Joe, you can contact him via text message and then speak to him after at 203-561-2024. Again, that's 203-561-2024. He is licensed in New York, Connecticut, and soon to be Florida, the Sunshine State. I love it. And if anyone here has found this time to be educational, empowering, and insightful to your health and well-being, please click on the button below and subscribe to my channel. And also, please feel free to share this with your friends and family and anybody you believe would benefit from today's episode on chiropractic treatment and also the subspecialty of treating the perinatal population, pregnant and postpartum moms. Thank you so much again for tuning in, and I look forward to sharing what you need to know next time. Take care and be well.